Going to have to take you live now to Adelaide, where the health authorities are providing a coronavirus update.
And he arrived in South Australia by road, and he travelled from New South Wales and came into South Australia in the early hours of Monday, the 21st of December. And my understanding is he also spent a little bit of time travelling through rural Victoria. But as per our direction at the moment, anybody who has travelled through rural New South Wales has to be have a COVID-19 test done, and indeed this young man did that, and this was the day of the 22nd of December, and we received that result last night. Now, the way the test works is we get a bit of an idea about how much virus is in the sample, and it depends on how many times the sample has to be amplified to be able to pick a positive result. So I was informed that that was a weekly positive result, but it was a definite positive result. And so we obviously put plans into place to have that person and close contacts moved into our Medi hotels, and also we were able to get very rapid testing of those close contacts. Now, I need to let you know that this is involving a small rural country town on the Yorke Peninsula, and so it takes a little bit longer to get results back, but I do want to thank the hospital and the local doctor and other people involved for helping us to facilitate this. The other thing that we do when we get a result of this kind is obviously we take a lot of information from the person to try and find out where their source of information might be. And in fact, this man had travelled from Darwin and had travelled into Sydney on a flight on Friday on the 18th of December. And in fact, on that flight, we already knew that there was a case of COVID-19. But the thing that was made it a little bit difficult for our staff to put two and two together was that they were quite widely separated on that flight. But of course, we've shared this information with the National Incident Room and with New South Wales, and my understanding is all of those people have been contacted and asked to quarantine, not just people sitting close to that original case. But anyway, as the story goes on, this person then was in Sydney airport for a period of time, and then travelled over to Wodonga, and then has travelled to South Australia. So the next thing that is very important in this story is that we get serology. And serology is a blood test, and that helps us be able to say whether this is an old case or a new case, because when you get a weekly positive result, it may be this is a new case developing, or it may be that it's actually viral shedding. And people might recall that even when you've recovered from COVID-19, you can still be producing fragments of the virus in the back of the nose, and it can be picked up on a swab. So what serology does is it looks at the immune reaction, or your body's reaction to the virus, and we measure an antibody response. Very similar to if somebody was given a vaccine, we would see that antibody response. And just before I came to this press conference, the laboratory informed me that the serology is positive, and in fact highly positive. This is much more likely than an old infection, and I've had a conversation with our clinical microbiologist who informed me of this. Now, this really does need verification, but given that I had that information, I did want to let South Australia know that it's my understanding that this is likely to be an old infection, and therefore nobody in South Australia is at any risk, but I will need to have that verification. So that is quite a complicated story, and thank you for following with me through that. The second case, as I mentioned, is a male in his 70s. He returned overseas on Thursday, the 18th of December, so this is somebody already in our Medi hotel. He was on a flight from Doha, QR914, and his day one test was negative, but we're testing all of our international travellers and also interstate travellers at the moment that require it, day 1, day 5 and day 12, and his day 5 test returned positive, and he's been in a Medi hotel since arrival. So all up now in South Australia, we will be saying, if I have confirmation, which it indeed seems very likely, that first case case I told you about as an old case. We still count that towards a case in South Australia, but there are 4 active cases, 4 from overseas, with 568 total cases, so an increase of 2 from yesterday. Now, I'm also very pleased to say that we're having a lot of testing done, and that might be because there are a lot of people from New South Wales in quarantine requiring testing, but we had over 5,000 tests processed yesterday. And just an absolute reminder to everybody in South Australia, I know that you want to enjoy Christmas with your family, but if you get any mild symptoms, bit of a sore throat, even just a little bit of a scratchy throat, bit of a runny nose, you must go and get tested. And to reiterate, all of our testing sites, or the majority of our testing sites, are open over the Christmas period. Please check our website first. There are many people that will need their day 5 test today, people who are in quarantine and people who have travelled from rural New South Wales. I know it's Christmas, but the expectation, and it is a legal direction, is that you do need to have that test on day 5. The other thing I will mention as well, and a little bit of a plug for our QR reader. So, of course, when we interviewed this person coming into South Australia, we've asked about whether they've been in certain venues within South Australia. And you can absolutely see the importance of not only people from interstate having our QR app, our SA Gov app, but also the fact that all venues in South Australia have those QR readers, because that would make it very easy for us to do any contact tracing if indeed we needed to. And I've got one of my children has come back from interstate yesterday, and I was very pleased when I asked her. She had already downloaded the app and was ready to use it here in South Australia. So do encourage all your friends and relatives to do the same. And also, I think this is perhaps a reminder to not just metropolitan South Australia, that there is a real risk of COVID-19, and people perhaps in metropolitan Adelaide are thinking about it a bit more because we have the Medi Hotel here, but it is indeed important for our regions as well. So all businesses and venues in regional South Australia also need to be complying with having that QR code ready for people to scan as you go in and out of those venues.
Professor,
thank you.
Professor, might we just go through that first case of some of those locations again, because it does sound like there were quite a few. Am I right in saying that that was a person that arrived back from overseas and passed through Darwin Sydney Airport?
No, you're not correct on that. So this is an Australian person who was in Darwin, and they have caught a domestic flight. They've travelled through to Sydney. They spent a short a period of time in the Sydney airport. They've caught a regional flight, and then they've got a car and they've driven through.
Is that a regional flight to Wodonga in Victoria? Yeah. Is that right? Mm-hmm. And then they've driven through. Yeah. And is the regional town on the Yorke Peninsula in question, is that Maitland?
Yes, look, we usually keep these things under fairly close wraps, but my media advisor has said that seems to be already known, and I guess in a small town these things do tend to get out. So I think this is perhaps good news for people there today, because it looks like this is indeed an old case, but an absolute reminder to no matter where you are in South Australia, there is always a risk of COVID-19.
Is there any concern that this man was infectious at any point along that train?
No, as I said, the serology, which has literally come off the press half an hour ago, looks as though there is a high antibody response. And if you have a recent infection, and if we were supposing that the source might have been on that Darwin-Sydney flight, then you wouldn't have had time to develop an antibody response like that. But I do need to get back to the office and verify all of that information. And of course, it's important for us to let that family know. And at the moment, they are in a Medi Hotel.
Professor, will these sites that the male visited in the Yorke Peninsula, will they be revealed?
Well, we would only reveal that if there was a public health need for it. And if we don't think that person's infectious, then there's absolutely no need to reveal that.
And is it almost a certainty that this case is not linked to anything relating to the Sydney Airport cluster?
No, and I don't think there is actually a Sydney Airport cluster as such, but this is in no way seems to be related to the cluster in New South Wales in the Northern Beaches, the Avalon cluster.
So is that man and his family members currently in a Medi hotel, are they likely to be released, and how many people are we talking about that have been isolated?
Absolutely. So, of course, I want to get that information to those people so that they are also aware of this, and there would be no need to keep people in a Medi hotel if there's no risk of infectiousness to anybody else.
How many people have been isolated as a result of this?
So my understanding is that there's 5 people.
And is there any indication at all as to where, if this is an old case, where it was first picked up?
Yeah, so that's a really good question, and those are the sorts of things that my team have been working on this morning. My understanding is that this person was in Victoria during the height of the pandemic there, when they had their outbreak in that October or August to October period. They haven't ever had symptoms of COVID-19. They've never been tested before, but we do know that there was a lot of COVID in the state at that time, and there were quite a lot of people who were asymptomatic.
And do we know if this, obviously there's quite a lot of detail, but do we know if this man was in Melbourne or was he always in regional Victoria in Wodonga?
I don't have those sorts of details at this time, no.
So is he a Qantas employee?
No.
At the time that he arrived in the state, there was obviously no requirement for him to isolate. Is that something, I guess, that you still stand by with people who are arriving from these states that are considered more of a high risk?
So this person was really transiting through New South Wales, and if they were transiting particularly through rural New South Wales, then I'm still quite confident that that is a lower risk. But as you know, even people from rural New South Wales do need to have that testing done.
Might go to the minister if that's all right.
Yes, Professor, sorry, just one more question. Just with Boxing Day sales tomorrow, what's your advice to people? Should they be wearing masks?
Yes, look, I haven't had much time to go shopping myself, but I've had a little bit of a need to go Christmas shopping, and it's quite busy in the mall at the moment. I think when you're outside and walking down Rundle Mall, you could be fine without a mask, but I personally feel a lot more comfortable in a crowded store wearing a mask, particularly if I'm asking one of the retail assistants for some help, or I'm paying for something. I know I'm actually quite close to that person, so I'm protecting not only them, but I'm protecting myself as well.
And how important it is for these people to continue social distancing, good hand hygiene, with these big crowds expected? What sort of message
it is just absolutely, it is absolutely critical. We just can't be saying to ourselves, it's Christmas, we haven't got COVID-19 here. It is still a serious, massive risk. We've got people quarantining in our state who have come from high-risk zones. So everybody has to be mindful of keeping that 1.5 metre distance, hand washing, and any symptoms whatsoever, get tested. Now, I'd like to see the breakdown of New South Wales versus SA testing. I know a lot of people from New South Wales need to get tested. But come on, SA, if you've got symptoms, please get tested.
Professor, just one more thing. I can't imagine that these 2 cases today change anything in terms of restrictions for us in South Australia?
No, I haven't advised that we need any changes in restriction, but we will definitely be monitoring this over the coming days. I will be meeting up with New South Wales Chief Health Officer, getting daily updates, and we'll be constantly monitoring the situation.
For people who might be worried about the announcement of this new case, I guess what would you say about how quickly you will be able to completely clarify the fact that it is believed to be an old case?
Well, I really just need to get back to the office, and I like to see things in writing just to have that verified. So we'll be able to update via a media release later this afternoon. Yeah. Thank you.